What up, what up, what up? What's up, YouTube? This is your boy, Robert Bob TV Brown with the Rod Report on the go. And I am on the go. I'm actually in the bathroom sitting on my throne. I know you don't want to visualize that, so get your mind at the gutter. All right, so CNBC reports that Cuomo is saying that we're back to where we started when it came to hospitalization falls to March level. In other words, we were falling, but I guess we are back up. Back to where we started. I don't know if it's positive where we started off with the coronavirus or whether we're going back up, but let me see. New York Governor Andrew Cuomo said on Sunday that the numbers of new daily COVID-19 hospitalization had returned to levels it was at when he issued a statewide closure of non-essential businesses nearly 2 months ago. Cuomo said that 521 people were hospitalized with the disease on Saturday and 207 died of it. The hospital figure, he said, takes us right back to where we started this hellish journey. Where we are today is basically with the numbers of cases is basically right where we were when we started. It has been a painful period of time between March 20th and May 9th. All right, so Governor Cuomo Andrews shows a face mask at a daily briefing on North Shore University Hospital during the outbreak of the coronavirus. All right, so hospitalization returned to levels. Cuomo said, well, we just read over that. Where we were today is basically with the number of new cases is basically right now where we were when we started. It was a painful period of time between March 20th and May 9th. Death figures have lagged those tracking hospitals. Cuomo said that of 207 fatalities take us back to almost where we started about a weekend as the numbers of deaths started to increase. So I guess we're going down. Still terribly high, but better, Cuomo said. Cuomo signed a New York State on pause executive order on March 20th that closed non-essential businesses and order residents to adopt a social distant measures. The number of new cases, hospitalizations, and deaths surged in the weeks that followed, but have since started to decline. All of this work, all of this progress of turning the tide, of reducing the rate of infection, thanks to all the New Yorkers and what New Yorkers did, Cuomo said. A total number confirmed COVID case in New York on March 20th was 7,102, more than 330 in-state. The hardest hit in the country have since tested positive, according to tracker maintained by state health authorities. More than 20,000 have died. Cuomo said Sunday that the state is looking to open its economy back on a regional basis. We're looking region to region across the state as to where it would be appropriate to reopen, he said. On March 20, stay-at-home orders is due to expire next Friday through Cuomo's recently signed an executive order enabling him to push back that deadline. All right, so push back that deadline. All right, I got a feeling he's going to push it forward. All right, because they don't have a set plan. And there's a lot of misinformation out there, and I'm going to go over that on the Rod Report. Basically, is this thing recording? Yeah, it's recording. Here's the deal. New York got a lot of people. So it's going to be easy for those numbers to go up if we go back to opening up the restaurants here in the city. Now, the region's going to start off first because they may have, they're not congested like we are. We're congested, okay? And we got a lot of people. Now, we're not going to allow people to come into this country yet. That's not going to happen for a while. But these are the things that need to be done. We need to be truthful on the information available out here. Number one, there's more than one kind of COVID virus. And a lot of times they're lumping anybody who have any kind of flu, any kind of sickness or disease into COVID-19 when they're really not COVID-19. They're just COVID, which is various types of influenza and different strains of influenza. Your normal flu, where you get the flu shot and all that, that's considered a COVID. I didn't take the flu shot because I don't want them putting this stuff in me. I don't want the virus in me. And who knows, that virus could wake up the virus that if I end up catching COVID-19, it could wake up the COVID virus that was shot into my system to stop the other virus from catching me. Just because you got a flu shot do not mean you're immune. There is no immunity from COVID, let alone will there be any immunity from COVID-19. A vaccine doesn't necessarily mean you're going to be immune from it. Most people are immune because they probably had it and their body adjusted to that particular strain. But it doesn't mean you're going to, another strain may come and not wake that up or do something to you. So here in New York, there is protocols. And at first it was done on a wartime basis. You got to understand we're at war with this thing. And the United States want to play money games and mind game and political games. And at the same time, people are dying. When other countries who don't play those money games, those mind games, don't stand to profit, most of them got universal health care. They leave their hospitals open for people to go. They don't try to profit off people, sicknesses, disease, and life. Countries like Nicaragua, countries like Korea, countries like, they're not Brazil, they're not trying to profit off of people. And what our country is doing right now is they're trying to shame medication to promote vaccination. Shame daily medication that you can take now to keep you from getting to the hospital, all in exchange for promoting a vaccination or promoting a new drug where they can profit from. If you look at Gilead starting out, look, I don't have nothing against Gilead. I'm all for helping people, but they tell that Gilead has remdesivir and that it could be a possible vaccine. Well, right now it's a treatment that's not treating everybody, and that treatment only goes to those people who halfway dead, already in the hospital, mostly on a ventilator, and they're going to shoot that intravenously in your vein to try to get you off the ventilator. So in other words, before you can get to that medicine, you have to be extremely bad off, pretty much on a ventilator. And they're going to put this in you to get you off the ventilator. There's medication right now that if you take it prophylactically, or if you take it once you get the symptoms, the chances of you going to the hospital is slim, very slim. You looked at the two doctors there at Lenox Hill Hospital in New York City. They've been using this regimen of hydrochloroquine, and people want to make a big deal and want to shame this drug because Trump mentioned it. He's not the creator of it. This drug been out for over 60 years. He just mentioned that it's doing great things. And it is doing, at that time, it was doing more than anything that we had before because we didn't have nothing. And at that time, hydrochloroquine was saving some lives. It wasn't a whole bunch of lives, but it was saving lives. Now, chloroquine is a different thing. It's not the same. I'm going to be talking about this a little more. Hydrochloroquine have saved lives. But since then, French doctors, since then, Italian doctors, since then, Korean doctors, different doctors in different countries have come up with a regimen. The doctor in France, and I'm going to have him do his testimony. He's not going to be on my show. I'm not that big time. But I'm going to show his video how he did his studies, and he got over 90% survival rate. And he tried to give it to people when they get the major symptoms. When they get the symptoms, he's just, he's like Dr. Zelenko here in New York, who copied that guy regimen, but he added some zinc. He added some vitamins. Some people adding vitamins and zinc. Dr. Zelenko is adding hydrochloroquine, azithromycin, and zinc. The doctor in Italy added hydrochloroquine and azithromycin, and his rate of survival in his studies and with his patients is 90%. Dr. Zelenko looked at the studies of various doctors in the country now that's not trying to profit. They're trying to save lives. So they tried a regimen. So he decided to listen to another one who was using hydroxychloroquine and zinc that was helping a lot of people save their lives. Not everybody in France, not everybody in Italy with these studies. So he decided, let me try both of their regimen. Let me try azithromycin. Let me try hydroxychloroquine, bring the dosage down a little bit, and try zinc. Now he's been trying zinc and he has been getting phenomenal rates. Matter of fact, 8 of my friends was COVID positive, and they went, their doctor prescribed them the regimen of Dr. Zelenko, and they are 100% better now. I mean, it's not going to be overnight. It's a regimen of hydrochloroquine, zinc, and Zithromax done over a period of time. I think 10 days. It is designed to what it is designed for the zinc to go in and open up a doorway for the Zithromax to go in to go in and clean the infected area, and the hydrochloroquine goes in and stop the virus from duplicating, virtually killing it. Because if it don't duplicate, it can't survive. So so that's just basically how I go in there trying to tell people that this stuff don't work. No, hydrochloroquine, if you give it to people who cannot take it, of course they're going to die. You have to make sure your doctor say you're able to take the hydrochloroquine. It's the same way with any medicine. And if you go out and do it on your own, you would die. And hydrochloroquine is not chlorine. But people want to make this about political. They want to make this about Trump. They're afraid Trump mentioned this. People going to think Trump is a hero. No, Trump is not a hero. Trump is doing his job. If there's medication out there and a doctor advises him on it, he's supposed to let the public know about it. He's not doing nothing. He's not a hero. He didn't discover this, but it's out there. So a man with a testimony is never at the feet of a person with an argument. So you can argue about the studies. So there are studies now. And the results of the studies, for those who are what they call urchins, people who got to get the information. I'm not an urchin. So, but since for you information people, there are studies out there. Now, Dr. Zelenko did a study over 1,500 patients, I believe. At least I know it's over 1,000. Over 1,000 patients. 500, he told them, look, you're young. I mean, according to statistics, 1% is only going to be affected by this virus. Okay. So you're young, you're strong, you're highly likely. Go home. You're going to be miserable, but take the medication like you do it with other flus. If it get worse and you can't breathe and things like that, then you come to me and I'll prescribe something for you, and I'll check you out. And then if I feel that you need to take it, you'll take it. I'll prescribe my regimen. So so out of 500 of those, he told him, look, go home, ride it out. I'm not going to give you a medication when you don't need it yet. If it gets super extreme, then I'll give you this medication. Right now, take the simple medication, Therapy, Cloflu, Tylenol, whatever, and bada boom, bada bang. And that worked for most of them. Some of them got a little more extreme, and they end up in that other category of 500, 600. But out of over 1,000 people, he gave, I think, about 250 the regimen. Over 1,000 went home fine. They beat it. 250 got a little bit worse. They couldn't breathe and they couldn't smell, and they were going through it. So Dr. Zelenko gave them the regimen of hydrochloroquine, Zithromax, and zinc. Majority of them survived. They went through the process. He said 4 ended up being on a ventilator, I believe. Out of the 4, 2 died. All right. And they already had serious pre-existing situations. It was too far gone for them. So out of his study, he has over a 90% success rate. But they're not telling you that. They're not telling you that, hey, this thing is really not the killer they claim it to be. It's serious. It can kill, but it's not the killer.